Long-term care is one of the biggest concerns when it comes to retirement, and it's a toughie because you can't know if you're going to even face any costs related to long-term care, maybe for a nursing home or dementia. And even if you do, how do you know how much you'll pay and where will the money come from? So that's what we'll cover in the next couple of minutes here, primarily focusing on where to get the money to pay for long-term care. And guess what? None of the options are perfect, but clients often find it helpful to review the various sources of funding so that they can envision how retirement might unfold. I hope it's helpful for you as well. And as we explore this topic, it's important to acknowledge that you might have one or two or multiple sources available to you if you're fortunate, but even if you live alone or you don't have deep pockets, it may be possible to get some quality care during your most vulnerable times. Long-term care primarily refers to custodial care. In other words, we're not talking about a physician providing medical care, but these might be other services that you need when you can't do things independently. A lot of times we talk about these in terms of activities of daily living, or ADLs, including bathing, dressing, grooming yourself, using the toilet, eating and preparing food, moving around, whether you're going from room to room or the doctor's office. In other words, just doing these things independently. And you might be unable to do that due to illness, age or frailty, maybe cognitive decline, an injury, or any other reason. And the cause doesn't matter so much as the need for help. That said, cognitive decline by itself could cause you to qualify for certain benefits. Even if you can do everything you need physically, if you're not able to manage your medications, for example, that can cause problems. Ultimately, your health and safety are at risk if you don't get help with some critical needs. And the key word here is long-term care. So there may also be situations throughout life where you need short-term care. That might be maybe after a surgery or an injury or something like that. But those episodes tend to clear up after a number of weeks or months. But for long-term care, we're talking about how to pay for nursing home care or worsening dementia that continues to last for several years. So who provides this care? It can come from several sources, including friends and family or unpaid caregivers. There might be professional services involved, nursing homes or retirement homes, maybe assisted living or memory care. These are all variations and have different degrees of care involved. Maybe volunteers in community programs help out, or adult daycare centers. It all depends on your needs and the situation. So, will you pay for long-term care, and how much might you expect to pay? Well, when your needs are minor, you might be able to make do with unpaid care. So that might be friends and loved ones who come and help prepare meals, or maybe a neighbor shovels the snow for you. But at some point, the needs may intensify. The situation could evolve to where your caregivers really need more skills or knowledge or even physical strength to do everything you need. For example, maybe you shouldn't count on an aging spouse to help you in and out of the bathtub because both of you could be at risk of injury, whether there's a strained back or somebody's going to slip. Plus, at some point, you might not want to rely on unpaid caregivers anymore. Maybe you don't want your neighbor to help you bathe, or maybe you just want more constant attention as your needs progress. A long-term care event can happen at any age due to an auto accident or illnesses or other events, but we're going to primarily focus on retirement here. So, for example, it's important to know how to pay for dementia or nursing home care as you age. Roughly half of all retirees might not face any long-term care costs, and in those cases, they might not need any care, or if they do need help, maybe an unpaid caregiver can do everything that's needed. And some people make do entirely with only unpaid help. But as conditions worsen, you may need additional support. For instance, you might want somebody to come to your home periodically. That's maybe cleaning up and preparing meals, or you might go into an assisted living facility. The cost of care depends on your location, the severity of the needs, and other factors. For example, paying for dementia can be among the most expensive situations. You might need 24-hour supervision and bed alarms and locked doors and memory care, and those costs can easily reach or exceed $10,000 per month in many areas. But if you just need somebody to come in and clean your home, the cost is understandably lower. You can always look at the typical costs of long-term care to look at some averages, maybe monthly or daily prices, and you can look at national averages or look at certain locations to get an idea of what you might expect for maybe homemaker services or even a private room. So it's going to depend on, again, what you need and where you are. I'll have a link to this in the description below, along with a lot of other resources, by the way. Now, you may wonder about Medicare. Doesn't that pay for everything you need health-related in retirement? And the answer is unfortunately no. Medicare will pay for a lot of medical expenses like doctor's expenses, hospitalizations, rehabilitation, medications, for example, but it pays almost nothing for long-term care. According to the U.S. Centers for Medicare and Medicaid Services, quote, you pay 100% for non-covered services, including most long-term care, end quote. So, Medicare generally does not pay for this type of custodial care. You can get some limited benefits for nursing and rehabilitation, but not for an extended long-term care event. And that's only when you meet specific requirements. So if you're imagining dementia or a long progression of diminishing health, Medicare is not the answer for funding custodial care, but it can help with doctors and hospital expenses. So how do you pay for long-term care? Well, there are several sources of funding available, and they each have pros and cons. We're going to primarily look at how to do it without insurance, but there are a couple of ways with insurance as well. And by the way, you may have other avenues available, so do some research to see if you have those opportunities. Briefly, I am Justin Pritchard, and I help people plan for retirement and invest for the future. And in the description below, as I mentioned, there will be links to some of the things we're looking at, as well as some more general information about retirement planning. I think you'll find all of that information really helpful, so be sure to check that out. And a friendly reminder, this is just a short video. We're not covering everything here, but this is some introductory information to help you start thinking about this. Then you can do more research and get a lot more information to make good decisions. First, it's important to think about unpaid care, and that might be all you need. In fact, that's the case for some people. So you might get help from friends and loved ones, maybe a spouse if you're married, or you can even look at aging in place, perhaps with a chosen family. Think about the Golden Girls scenario here. That might be an option for you. That approach is great because it doesn't drain financial resources and you can stay at home. But a challenge is the strain that it can put on caregivers, and you really need to be able to depend on everybody involved. So your loved ones are probably eager to help, and they may prefer to be your caregiver instead of having strangers provide care in a facility. But in some situations, the need for more expertise or physical strength or 24-hour care can be overwhelming, and there might be limits as to what others can do for you. So if things evolve, you may just need outside help. Plus, what if your caregivers get sick or injured? A loved one's desire to help can actually have consequences, negative consequences for the person needing care, even though they're trying to do the best. So for example, there could be a situation where skin irritation and other complications arise if the patient is incontinent and the caregiver isn't checking often enough because they need to sleep through the night, for example. Another option is to pay out of your assets, also known as self-funding. And when you pay for services yourself, you can get professionals involved, and you have a high degree of control over who will and who won't provide care. At the same time, those costs can be unpredictable and substantial. Many people don't have and won't have the resources to cover a significant long-term care event. So if you just need somebody to help out around the house a couple times a week, that's one thing. But if the demands rise, the cost can really increase. So when you're evaluating this option, look at the costs of care in your area and then factor in inflation to prepare for some future costs, and remember that healthcare costs have tended to rise more quickly than other costs. When I'm working with clients, I estimate an amount based on some assumptions about their location and their health, and of course you'll never predict the future accurately, but you need to start somewhere. And then look at whether or not you expect to have those assets available at the end of your life. That brings up a question of if it's realistic. So you have to ask yourself if you want to reserve significant assets for a long-term care event. By keeping that big cushion set aside, you might significantly reduce your retirement spending or your chances of success. So we're talking about hundreds of thousands of dollars, and today's dollars. And if that doesn't appeal to you, or if it's just not realistic, then maybe a couple of the alternatives we're going to get to next would make more sense. There's also the question of what happens if you run out of money. So if you've been paying for care in an assisted living facility, will they kick you out? Well, that gets complicated, and the details depend on where you are when you run out of money and your state and your health and other factors. But it is possible to get evicted from an assisted living facility when you run out of money. You would generally go on Medicaid, but you may need to relocate to a nursing home with different amenities, and that's going to maybe be a hard change for you. That said, it could be possible to stay where you are if you meet some very specific requirements, and you might consider starting in assisted living facilities that have contracts with Medicare if you want to improve the chances of staying put when those assets run dry. Next, we have long-term care insurance, and that is specifically designed for long-term care and can be really helpful and provide substantial resources if you need care. However, the coverage can be expensive and complicated. So we're not going to dive deep into long-term care insurance here. You probably already know it's an option, and if the concept is new to you, then it's worth researching and exploring the pros and cons. Now, some people suggest rules of thumb for long-term care insurance. They say if you're below a certain level of assets, paying for long-term care insurance isn't your best option. They'd suggest spending down assets and going on Medicaid instead. But if you're above a certain asset threshold, those rules of thumb might suggest you don't need long-term care insurance either, because you have enough to self-fund, and that can be debated in a number of different ways. But again, those rules of thumb might say that only those who fall in between the asset levels would be candidates for coverage, and I don't necessarily buy into those rules of thumb, but that's one way of thinking about it. Those rules of thumb are always imperfect, and while there may be some sensible rationale behind them, you really want to do a detailed and individual analysis, because you might have objectives that differ from what those rules of thumb are based on, and opting for or against insurance really depends on your specifics. And you might also want to use different asset levels, whether higher or lower. So look into this for yourself and then make a decision on what makes the most sense. One reason to consider long-term care insurance is if you have goals to pass assets on to others. That's because when you buy certain forms of long-term care insurance, you might be able to preserve some assets if you go on Medicaid eventually. So you'd want to look into state long-term care partnership programs for more information on that. Next, we have home equity, and there are at least two ways to put that equity in your home to work. One is downsizing, and the other is with a reverse mortgage. A reverse mortgage enables you to access your home equity for anything you need, including long-term care expenses. But for that to work, you need sufficient equity in the home, and you need to meet some specific requirements. Plus, it's important to consider what happens with your home in the future. So do other people live there, or do you intend to pass the property on to loved ones? And if so, you'll need to think about how to make all of that work. And you can also tap your home equity through downsizing or relocating. So when your health declines, that might be an excellent time to simplify life, perhaps favoring a single-level residence that you don't even need to maintain yourself. So you could move out of where you are and move into a much easier place. You can even explore buying into certain communities with your home equity. And again, that's an extremely complex topic for a different day. Now, when working with clients, we often look into their home equity and make some assumptions about how the property might change in value. Then they decide, what's the purpose of that equity? Is it a safety net for long-term care, or do they want to pass it on to somebody else, or are there other goals? Those funds can provide a substantial cash injection to some financial plans if needed. Next, we have life insurance. So if you have a permanent life insurance policy in place, you might be able to use funds from that for certain expenses. One option is to use the cash value through loans or withdrawals, but it's critical to review those strategies with an insurance expert and your CPA before doing anything, because you can potentially reduce or lose your coverage, and there may be tax consequences as a result of dipping into that cash value. You might also have early access to a life insurance death benefit. So if your policy offers an accelerated death benefit and you're terminally ill or you otherwise qualify, you can potentially get some money out tax-free. That will reduce the death benefit, but it may be very helpful. Again, there are those pros and cons, so you need to discuss this with several experts before taking any action. And sometimes, taking that money out can cause you to lose eligibility for Medicaid or other programs, so you really want to be careful. So to use that option, of course, you need a life insurance policy in place, and that may only be feasible for those of you with existing policies that you don't really need anymore for other purposes. Next, we have Medicaid. That's a needs-based safety net that can help you when you have limited assets and income. So if paying for long-term care drains your resources, you would likely go on Medicaid. Then you could get custodial care and medical care and other services at a minimal cost or potentially at no cost at all. So to qualify for the most generous benefits, you need to meet requirements that vary from state to state. So you really need to research those programs for the area you plan to retire in. In general, you want to expect to have little or no income and assets other than maybe a primary residence and some personal belongings, but you want to verify all of this with an expert before you assume anything. Medicaid gets a bad rap, and it's probably not your first choice. After all, it's always helpful to have assets and numerous options available, and the experience at private pay facilities should be better, presumably, but using Medicaid is not necessarily disastrous. It's the only option for many people, and as with other areas of healthcare, your care often depends on specifics like where you are and who's on shift when you need care. Medicaid can have rigid rules, and it may take several months to get approved for Medicaid. So be aware that long-term care programs can be separate from basic health care Medicaid. So start the process of checking all those boxes and applying long before the actual need arises. You also want to be mindful of Medicaid's look-back rules. So it can be tempting to just give all your money away so that you qualify for Medicaid. But unfortunately, there are what's called look-back rules, and they typically look back about 5 years at any transfers you've made. So you really want to work closely with an elder law attorney or somebody who specializes in that if you're going to try to get yourself on Medicaid. So that's long-term care, and this video popping up now should give you a better idea of other costs to plan for in retirement, give you some tools to estimate that. I hope you found all of this helpful. If you did, please leave a quick thumbs up. Thank you, and take care.